Well, good afternoon, everyone, and welcome to our community conversation event hosted by the County of Marin and Marin Health and Human Services. I'm Lainey Hendricks, Public Information Officer for the County of Marin, and I'll be your moderator this afternoon. Today's event will discuss recent COVID-19 activity, the current shelter-in-place order, and the status of our business reopening effort, as well as touch on a number of questions submitted by you, our viewers. Before I begin, I want to remind you that you can find the latest information about COVID-19 activity in Marin by visiting coronavirus.marinhhs.org. On that webpage, you can also sign up to receive our status updates, which contain an overview of confirmed case data and other updates about Marin's response to the COVID-19 pandemic. Simply click on the subscribe button on the website's resources menu, or to receive updates by text message, you can text the phrase Marin COVID to 468-311. Well, it's been almost 4 months since the Bay Area implemented a regional shelter-at-home order in response to the COVID-19 pandemic. Residents and businesses have had to make major changes to adapt to the pandemic. Congregate living areas such as senior nursing facilities and San Quentin State Prison have experienced outbreaks. The virus still exists in our community, and hospital surge is still a possibility. When might the shelter-in-place order be lifted? Well, that's a question on the minds of many. And to walk us through this conversation, a panel of experts that I will introduce to you now. First, I'd like to welcome Dr. Matt Willis, Marin's Public Health Officer. Also joining us is Angela Nicholson, who serves as the Director of Marin's Emergency Operations Center. And finally, I'd welcome Max Korten, Marin Recovers Director, overseeing our business reopening and recovery effort. Our format this afternoon is we're going to start with an update from Dr. Willis regarding the COVID-19 activity here in Marin County. Then we'll hear a brief update on the Marin Recovers business reopening effort, and then we'll dive into some of the questions that were submitted by viewers earlier this week. So with that, I'm going to hand it over to Dr. Willis to open up our discussion.
Thank you, Lainey. And I prepared a brief presentation to go over the status of where we are right now, and then we'll have some time with Max and Angela to review the Marin Recovers effort, and then leave plenty of time for some of the questions that you all submitted. So I'm going to share my screen. Can you see that?
Yeah.
Great. So I'm going to start with just the update on the current status. If I can advance my slides, I would do that. See if that works. It doesn't seem to want to. It is. I know it's quite a nice title slide. There we go. So hopefully it won't be that delayed each time. This is just, I want to start with our basic understanding of how we define health in Marin. This is from the World Health Organization, the Constitution developed just after World War II, when there was a more global understanding of what we think of when we think of health and human rights. And importantly, I think it's really helps guide us in the decisions facing us around COVID-19, because it orients us to the reality that it's not just simply preventing transmission of COVID-19 that's driving our public health approach. It's a more holistic understanding that health represents a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's, I think, important overall framing and explains why the Marin Recovers effort was so important, because it brings into the context the economic well-being and social well-being that is also so important for us to consider. This is the total cumulative cases we've had in Marin County since the beginning of the pandemic. And what you see is basically just a continuing acceleration. If you just see the arc of that curve, the curve is obviously rising because we have more cases each day. But more importantly, the slope of that curve is also increasing. And so this is a surge that we're seeing in cases in Marin. And really the most rapid period of acceleration started about mid-June. And this is a pattern that's been observed throughout the region and the state. Importantly, the bottom yellow dotted line there represents hospitalizations. What that shows is that despite the fact that we've had a lot of increase in overall cases, the proportion of people that are hospitalized has actually decreased. And that's partly because as we have more cases, there tends to be a higher proportion of people who are younger and in the workforce and are healthier and tend to have less severe symptoms. So fortunately, our hospitalization rate hasn't changed as much as our case rate. These are the total tests that we've done. Testing has been a real challenge across the nation in our experience of this pandemic. We did a lot of work early on to try and acquire testing resources into Marin. I think our approach, particularly in Marin, has recognized that we need that data, that information to really guide our strategies and understand where the virus is flowing within our community, which groups are more affected, which occupations are most influenced. And that's only through testing we'll be able to accomplish that. So we had set a goal of 500 tests per day on average. And actually we've exceeded that goal now. And you can see here that on some days we're testing north of 800 tests on a given day. The bottom there, importantly, shows the proportion of tests that are positive. Some people, see that increase in cases and say, well, of course you're seeing more cases, you're doing more testing. And what that bottom graph shows there, that line shows that unfortunately, as we do more testing, we're also seeing a gradual increase in the proportion of tests that are actually positive. And that's an important reflection of actual transmission of the virus being increased, and not just, and our increases are not just based on testing rates. This is also one of the things that we look at most closely, and I think is one of the more concerning of the more recent trends, and is that this is the proportion, the number of people who are in our hospitals. So when we talk about surge, we're talking about hospitalization rates. And today we have 32 people in the hospital in Marin. That's, I think yesterday at 35 was the highest we'd had on any given day. And 8 are in ICU. This is importantly influenced by a combination of factors. We're having an outbreak at one of our skilled nursing facilities, and a few people have been hospitalized from there. Obviously, the outbreak at San Quentin prison, which I'll go into shortly, is contributing to this. And then also people from our own community. We're having increased hospitalizations related to the surge in cases of members of our community as a whole. This slide shows the contribution of San Quentin to our total hospitalizations. Again, because I'm looking at hospitalizations so closely, it's important to differentiate what are the different contributors. It's reassuring in some ways to know that of those 32, 11 are San Quentin inmates and 22 are coming from our community. So if there wasn't that outbreak occurring at San Quentin, our hospitalization rate would be 21 at this time, which wouldn't be quite as much of a surge as it seems to be right now. This shows that just the demographics of our cases over time. We have had 1,500 something cases up. I haven't seen the numbers keep changing. The numbers are updated continuously through the day. And so anyone can look at coronavirus.marinhhs.org and see the latest numbers as they get updated in real time. What this shows is the proportion of cases tends to be a little bit higher among men, and that's been a national, international reality, and probably relates to something intrinsic to the immune system, the differences between men and women. On the right there is one of the most important factors of our experience of this pandemic in Marin County. You see those donuts that show the proportional distribution of different race ethnicities within our county. The upper left one just shows our baseline population: 71% white, 16% Hispanic, 6% Asian, and 2% Black African American, and 4% other. In terms of our cases, we have 78% of our cases are people who identify as Hispanic or Latino. So far overrepresented, more than 10 times overrepresented compared to other race ethnicities. And that's related to that particular demographic and reality that so many people who lower income Spanish speaking community members who are also part of the backbone of our economy have been out in the essential workforce since the beginning of the shelter in place. and bringing virus into households where there's transmission within that household, where one case might easily lead to 5 or 6 cases, depending on how that apartment or household is arranged. This is the age distribution. Again, reinforces what we know to be the pattern nationally in Marin. While people above age 65 make up only about 20% of our overall population, they make up 90% of our COVID-19 deaths. We've had 22 deaths so far, only 2 in anyone less than age 65. What this shows is what I was illustrating before, which is that as our case counts increase, the proportion of people who have been infected who end up in the hospital has decreased, and that's related to what I described in terms of the essential workforce. The more recent diagnostic patterns relate to people who are out in the workforce, tend to be healthier, tend to be younger, less likely to be hospitalized. The most important thing I want to call your attention to on this graph is just that is the green line on the bottom there. What this shows is the number of cases as they've increased over time since the beginning of the pandemic by age group. And what this shows is that above age 65 age group is the one that we are most concerned about when it comes to mortality. So if we want to talk about flattening the curve as specifically as possible, that's the curve we want to flatten most. It's cases among those older people. And we do see it increasing, but it has increased much less than cases in younger people. And so sort of our collective effort should really be oriented towards maintaining that protection for that most vulnerable group. I'm going to get into there are a lot of questions that came across about San Quentin. I've spent most of this week out on site at San Quentin. You might remember that on June 24th, our Board of Supervisors wrote a letter to Governor Newsom. There was at that time about 400 cases at San Quentin, asking for the establishment of an incident command system to come to Marin County, to San Quentin, and really establish that disaster response infrastructure that would be needed to manage this complex outbreak that was essentially out of control. In addition, we asked for them to establish an on-site medical facility to manage the increasing number of inmates who were becoming ill and requiring hospitalization. We were particularly affected by that because we are the closest hospitals, and Marin Health has a contract with San Quentin Prison, and many of the inmates in the early days of that outbreak were coming straight to the emergency departments. And so we chose to take this action to reach out to the state to really ask for a more robust disaster response infrastructure. That arrived last week, and I was able to join that team on site. It was led by the California Office of Emergency Services and Public Health, along with the Department of Corrections and Rehabilitation, entered into a new partnership to really have the response we needed. One of the most, I think, inspiring aspects of that was the conversion of a huge warehouse there that was dedicated to job training. On the left there, you see historically that's been a job training site for decades at San Quentin. And on the right there, you see what it looked like yesterday as they were setting it up to become a medical facility for 220 inmates who could be transferred there for care if they need oxygen, if they need more closer monitoring. And that will obviously offer them the care that they deserve and need, but also reduce the rate of people who would be needing to come out of that facility for hospitalization. There are now 1,674 cases of COVID-19 at San Quentin of the 3,600 inmates. 100 have been transferred out to hospitals throughout the region. Part of the incident command response was to establish a more regional and more rational distribution network so that all of those inmates who become ill enough to require hospitalizations are getting the timely and appropriate care that they deserve. Our hospitals, I think, have, as I mentioned, have 12 San Quentin inmates currently. So these are the primary drivers of increased cases in Marin. I've mentioned this, essential workers, mainly Latinx, the index case for the household, transmission within the household, a high proportion of people who are asymptomatic or mildly symptomatic. The strategy there is to partner with community-based organizations. We really recognize that The strategies need to be informed by people who understand and are trusted by people within those communities. And the Department of Health and Human Services and the county has partnered with a variety of community-based organizations and faith-based organizations that Angela can talk more about. With bilingual, bicultural capacity, we're reaching out to employers and the community and doing a lot of testing in that community, really, to make sure that we're identifying cases as early as possible, do the contact tracing, and offer support for their families. By contrast, the primary driver of mortality in Marin County is another, right now, what's happening today. In fact, it's been in the media of an outbreak in one of our skilled nursing facilities. About 80% of our deaths in Marin have been in people who were in skilled nursing facilities or residential care facilities for the elderly when an outbreak or transmission occurred in that setting. These are congregate settings. In some ways, the dynamic are similar to San Quentin in that when you have people who are gathered closer together in an institution, the risk for spread is enhanced, and it's challenging to actually, there's no substitute for prevention and making sure that it doesn't establish a foothold in the first place. Most of those outbreaks have occurred because a staff member has brought it into the facility. In fact, all that we've been able to track, which makes sense because that community has otherwise been sequestered. And all of those deaths in those settings have been above age 70. So we have a strike team that goes out and makes the rounds of all of our facilities to ensure that they have proper PPE, proper education, infection control. We've prevented visitors from visiting. We're testing all staff monthly, and I've written an order that every facility needs to have their staff tested every month. And then we have an aggressive on-site intervention with the strike team that can be there in a matter of hours, the first time a case is diagnosed within that facility, to test all residents and staff and ensure that they have the practices they need to early intervene and stop spread. So this is, the message there is because staff are bringing these infections in, many are asymptomatic. Ultimately, the solution is for all of us to do our part to limit transmission within our lives, within the community when we're out and about. And I just wanted to share this with you to illustrate the importance of facial covering. This is something that we continue to highlight as a strategy. But it's true that if we are all covering our face vigilantly when we're around other people, the risk of transmission is significantly reduced by 90%. And this just shows that, here's someone on the up there who's speaking and talking without a mask, and the virus is spreading through droplets to those that they're exposing. The person who's at highest risk is the person near them that is not wearing a mask. And then lower, when you see that same person with their face covered, the amount of virus that's coming out is significantly reduced. And the person who's wearing a mask and facing them is even further protected. So and here's another way. This is so important. I thought I would share two versions of the same. We talk about 6 feet. This is the reason why 6 feet is important. When someone is not wearing a mask and if they cough, the particles will generally settle within 6 feet. For just regular breathing or speaking, it's generally about closer to 4 feet. And a sneeze where the velocity can be very high can be much further out. So this 6 feet is an important principle, but it's actually a continuum of risk. And the best way to protect ourselves is to be covering our faces. I wear my mask for you, you wear your mask for me. It's a matter of community responsibility. I'm just going to talk briefly now about the watch list. You may be aware that Marin County was placed on the state monitoring list. This is based on, as the state has seen increased transmission across the state, they established a process for ensuring that counties that were seeing increased transmission were not moving forward too quickly in the shelter in place. We have joined now, I think it's 26 counties. In fact, the vast majority of people who live in the state of California are in counties that are on the watch list. It's about 4 out of 5 residents now. And so what this has meant for us was the step that we had taken on June 29th to move forward with opening indoor restaurants. We needed to reverse that once we reached that state monitoring list. And for us, it was based on that criteria outlined there on the upper right, which is elevated disease transmission with a case rate of greater than 100, or a case rate of greater than 25 with a positivity of greater than 8%. We have a case rate of greater than 100, and our percent positivity is almost 8%. It's about 7%. So this is one of the other news that just 2 days ago, the state announced that they're mobilizing a strike team that will be sent to the businesses and the communities across the state where they may not be adhering to the law and the standards, using existing infrastructure. So the Department of Alcoholic Beverage Control, the ABC, the Board of Barbering and Cosmetology, Cal OSHA, they have regulatory authority over businesses of different types and can use that to enforce. So ABC could suspend a liquor license, for example, or even fine a business that's not adhering to the standards established for the shelter in place, such as 6 feet distancing between individuals who are seated at tables, or facial covering for staff, et cetera. The process for sending that strike team to businesses within our own community would be through the county, and the reporting mechanism we've just established is a new email address, which is listed on the bottom there, which is sipviolation@marincounty.org. sipviolation@marincounty.org, and you can outline the nature of the infraction, and we'll collect those and make a decision about what we should elevate to the state for the strike team. We're also developing our own Marin County strike team under Angela, and she can talk about that in a bit. So importantly, as we navigate these really challenging decisions about opening sectors amidst increased transmission, just for us to all remember, what are the basic principles that we're looking to? One is that we're aware that for anyone to become infected, there needs to be a sufficient dose of the virus. And we think that's about 1,000 virus particles that can be acquired all at once if someone sneezes on you and you breathe without a mask, or over time, over an interval of hours where there's a low amount that's being emitted and you may not be protected. And you could become infected over a period of hours with that accumulated dose. That's determined by the duration of time where you're exposed, the proximity, whether or not facial covering is used, whether or not it happens indoors or outdoors. Outdoors, the risk is much lower because it diffuses, and whether or not it's settled on a surface that you then may touch and then touch your face. And then the other determinant in terms of decision-making for the shelter in place is the law. And as the watch list designation indicates, we are not free to move forward now in many of the domains we had planned to, based on that designation being on the watch list was less for 3 weeks, and is why we had to close indoor restaurants. So this is our challenge as I see it, and as we've been framing it. How do we safely continue to reopen, knowing the virus is part of our environment? We do it carefully, we do it together, we optimize self-measures. It's really in our hands. We move outside as much as possible. Anything that can be done outdoors can be done more safely outdoors. Recognizing risk, it's important, I think, for all of us to understand our own risk factors, especially for our older residents. Just because it's allowable doesn't mean it's safe. Maybe choosing not to engage in things that we know might put us at risk of transmission, even if it's allowed. We're following the data. That's the best way for us to understand where we are as a community and what's safe or not, is really to lean into the data. And we encourage all of you to look at the data we have available for the public on our website. We have to be adaptive and flexible and rethink our assumptions about how things are done. I'm going to hand it over to Max to describe in more detail the Marin Recovers initiative. Thank you.
Thanks, Matt.
I can advance your slides, Max.
Oh, thank you. And good afternoon, everybody. I'm Max Korten. My usual job is I'm the director of Marin County Parks and Open Space, but as all of us public employees, we're volunteering in new different ways to help serve our community in this really challenging time. And so I've been helping to lead the Marin Recovers effort. And this is an effort we started, I think, about 2 months ago, And it was really to engage our community leaders, our business community, in an effort to figure out ways that we could reopen different sectors of our businesses and our community safely in partnership with public health. And so I'd like to start by just offering a huge thanks to all of the business leaders and other community leaders who stepped up to join teams. And actually, Matt, do you want to advance the slide here? We put together, you can see here, I think it looks like about 15 teams, but there were actually a lot of subgroups within many of these groups who got together, and really it was an inspiring effort to see the leadership in our community that came together to figure out ways for these different industries and different parts of our community to potentially reopen safely. And so these groups put together guidance initially when there wasn't state guidance available. And then more recently, the state has been putting forward its own guidance that we've also been adopting. And so on 2-week increments, we have been working together to provide this potential guidance to Dr. Willis. And then as the indicators that Dr. Willis mentioned allow us to, then those different sectors have been allowed to reopen as long as they're able to follow the guidance. And part of this effort was to create site-specific protection plans, which is a template for businesses to follow to train staff to reorganize their space and their business to be able to reopen safely. And it's a self-certification process that they post in their windows so that the public and customers can see that they have followed this process. And before going on to the next slide, I also just want to really thank both that leadership from the community and also initially the leadership of supervisors Katie Rice and Dennis Rodoni, who helped to initiate this process and develop this. And then at this point, we've been reopening a lot of these segments, and we're transitioning to working with the different subcommittee of the Board of Supervisors, Supervisor Damon Connolly and Supervisor Judy Arnold, who are leading a larger Marin Economic Recovery committee that is looking at how to support our entire business community and economy in Marin County going forward. And so a big thank you to them, also to the members of that committee, including the Chambers of Commerce from our different communities, Council Member Kate Collin from San Rafael, and Council Member Brian Colbert from San Anselmo, who have really had a lot of leadership in this effort. If you go to the next slide. So as Dr. Willis was mentioning, really what drives our ability to reopen these sectors is the indicators from our healthcare system. And this is a dashboard that our team has put together and that shows sort of where we're at with these indicators that will help individuals sort of understand how we're able to move forward. I don't know, Angela, do you want to say anything else about this? I want to introduce Angela Nicholson's the director of our Emergency Operations Center and really is the glue that holds all this together.
Good afternoon, everyone. In my normal job, I am the Assistant County Administrator, but have been in the EOC since we opened. These indicators, Dr. Willis, you may want to speak more about them, but Dr. Willis spoke about them initially. I think we're really looking at the number of cases that we've had per 100,000 over the last 14 days. And that's been a number that for state purposes, we ended up on the watch list when we got over 100 cases per 100,000. And as of today, we have 235 cases in the last 14 days per 100,000. So we are significantly over the state indicator on that one. We're also looking at that positivity rate. And I think Dr. Willis showed us a graph about if it was just that we were testing more and the positivity rate was staying the same, it wouldn't be so much of a concern. But our positivity rate has increased. And I think today we're around 7.5%. Once we hit 8%, we move into that next moderate level where it's an additional level of concern for us. But you can see the other things we're watching every single day. We're looking at how many patients have been hospitalized, what percentage of patients are in the ICU, we're really concentrating on making sure we've got hospital space and that ensuring that our hospitals have the capacity to handle people that are sick. So these are when you are imagining us thinking about how do we decide what we open, these are the main things that we're considering when we decide what to open next. Matt, do you want to add anything?
Yeah, sure. Just that the public health readiness there, the fourth or fifth row, is really sort of an aggregated indicator of things that we've been talking about a lot in terms of positive, personal protective equipment, PPE, testing capacity, surge capacity, contact tracing capacity, and we're moving really independently as fast as we can in all of those domains, and keeping up with increased demand for all of that. Our PPE supplies are being strained. We are making more and more requests to the state. We're keeping up with the demand, but that's also now starting to be a space where we're starting to see some stress again. The surge capacity, fortunately, we established an ACS, an alternate care site near the Civic Center where we have beds ready to go if we need them. If there's going to be overflow from our hospitals, we actually have that in the can, and that's standing ready if we need that resource. So we're confident that we have used the past 2 months, 3 months while we were sheltering in place to build up that capacity, and it's looking like we're starting to, it's a good thing we did because we're starting to use it. That's all I have on that, Angela.
Great, thank you.
Do you want to go to the next slide, Matt? Okay, so I think this is our last slide. And, to sort of bring us up to where we are now, we've been working every 2 weeks to reopen different sectors of the economy. And at this point, because of where our indicators are, this effort's paused until the indicators improve. And I think one of the things that we're really focusing on during this pause is getting out a public message about some of these individual responsibilities that people can take to protect themselves and protect the community. And so this is, an example of some of the messaging about face coverings. And I just saw today that Caltrans is helping out to put up on the lighted signs messages about face coverings, and really that the Marin Economic Recovery Committee as well is very focused on providing messaging for business owners and others within our community to help get this message out, because the more that everyone is able to follow these, the more possibility we'll have of being able to reopen things safely.
There you go. We can do it. This is my son at the Rosie the Riveter Museum reminding us that we're in this together, and we can do it. Should we open it up to questions, Lainey?
Yeah, awesome. Thank you so much for this really comprehensive presentation. And I want to remind all of our viewers that if you were interested in exploring some of those data models that Dr. Willis shared with us during his presentation, those are all available online on our coronavirus website on our data and surveillance page. And so you can find that by visiting coronavirus.marinhhs.org/surveillance. The page is updated daily during the week, and we encourage any of you that with questions about, where are our cases based, or what is the impact on our hospitals, please go and check out that resource. Like I mentioned, it's updated daily for your knowledge and use. It also came to our attention that this is a rare situation for the County of Marin, but we actually have exceeded our limit on Zoom participants. So our apologies to any of you that may have had to surf over to Facebook in order to watch, but we are recording this presentation and we will make it available on our YouTube channel. We will make sure we post that on our website as well as publish it in our upcoming status update. So that you can watch this entire presentation start to finish without interruption. So apologies again if you were not able to join by Zoom, but we'll make sure we remediate that before future town hall type events. For those of you that are just joining us, this is our community conversation event hosted by the County of Marin and Marin Health and Human Services, and we're joined by Dr. Matt Willis, Marin's Public Health Officer, Angela Nicholson, Director of Marin's Emergency Operations Center, and Max Korten, our Marin Recovers Director, who is also overseeing our business recovery and reopening efforts. I want to take a minute before we start our question and answer period to thank the nearly 100 people who submitted questions in advance of the event. Unfortunately, we only allotted maybe 30 more minutes for this event, so it's impossible to get through every single question, but we will do our very best, and we've tried to group those questions in according to theme. So without further ado, I'll go ahead and dive in to our first question. And being that we just wrapped up with business related questions, I'll start there. So as you can imagine, we have received a number of questions about the reopening status for various businesses, whether it be nail salons or gyms or bowling alleys, or whether doubles tennis with people outside the household can be played. And I want to thank you for showing us the dashboard that really helps us understand that decision as to when Marin might be able to move forward. I'm wondering if we might be able to tell our viewers if there's a timeline for future reopenings for these businesses and activities. Any light you can shed on that?
I can start with that. Yeah, I think we all are eager to have a better sense of what the future holds. And I think as a principle, we recognize that we are trying to, as much as possible, offer clarity for forecasting and planning purposes. I think we've also recognized that there are limitations to that. You know, our decision on June 25th to hold back on some things that we had planned to go forward with on June 29th is a reflection of that need for to balance our value of clarity and scheduling with being flexible and adaptive to what the virus is telling us we need to do in our community. That day we had more cases than we'd ever had before. We saw surges in people coming into the hospital, and we made a decision that it would not be safe for us to go ahead and move as aggressively forward as we had chosen to. Then a week later, the state placed us on the watch list, and had we gone forward on that Monday, we would have had to reverse all of those things, or many of those things we had chosen to preemptively not move forward in. So I think that was an illustration of the spirit that we're going to be needing to engage in together as we move forward with this. And I hope with the data that I've shared with you in terms of surges in cases and hospitalizations, the wild card of San Quentin has been introduced in this environment, that really it's a time for us to take a pause and see what happens over even just the next few days. I think will tell us a lot. And I think also a reminder of how important it is for us to do, those of us that have the freedom to control our exposures, to control our behavior, the choices, it's time to double down on those things, because the last thing we need is another source of infections. We're fighting battles on so many fronts already with the skilled nursing facilities, with the prison. Those opportunities we have to actually control this within our own lives and our own behaviors are doubly important.
Well, you mentioned the phrase, now is the time to double down. We were watching cases rise, and there was the decision to hold back on some and yet continue to reopen others. Would Marin Public Health ever entertain the idea of taking a step backward and in strengthening the shelter-in-place order in terms of that double down mentality?
Yeah, we know that's a tool that's available to us. I mean, that was how we, initially reacted in earlier mid-March with a much more restrictive shelter-in-place order. One of the reasons we've been cautious in moving forward is that our approach has really been to move forward more slowly rather than have to move backwards. But I think this is the state is looking at what's happening across the state, looking at the numbers. And there's some conversation about whether or not there needs to be a more aggressive return to a shelter in place that might be imposed by the state. And that's, I think, another important factor for our community members to recognize is that there's really two layers. There's the local health officer order, and then there's what the state might determine is important for us. And the consideration that the state might close things in Marin, I think is active and on the table. I had a conversation earlier with the 6 health officers in the Core Bay area counties today, and we're all thinking about these concepts of how do we move forward as quickly as possible amidst increased transmission, and we would very reluctantly, but it's move backwards, but if it was necessary, we would.
I want to add to that I think the personal responsibility piece, our ability to move forward is really dependent upon people masking and sanitizing and staying 6 feet apart. I think, we're very conscious about the economic health of our businesses too. So that's been a big part of our conversation in Marin Recovers. And we continue to talk about that, but in order to continue to reopen, we really have to have people owning the fact that they continue to mask. And if they don't do that, it's going to be really hard. It makes it harder for us to move forward.
So on that thread, what's being done to enforce that? We've heard many reports of individuals being at businesses and perhaps patrons not, wearing their masks or wearing their masks to go inside, but then taking it off once inside or whatever it may be. So let's talk about that enforcement side of it.
So I think Dr. Willis mentioned this earlier, and we've today launched a new email address. We would encourage you to email if you're finding businesses that are not in compliance with the shelter-in-place order. And that is SIP, shelter-in-place violation at marincounty.org. We have the state enforcement team that Dr. Willis mentioned, and they are actively enforcing around the state and particularly enforcing in counties that are on the watch list. And additionally, we are in the EOC working to convene a local enforcement team as well. And I'm happy to be working with the cities and the towns to be putting that enforcement effort together. It's really important that people comply with the order. And so both businesses and individuals should be complying with the orders. And we're working to make sure that we've got enforcement plans in place.
Can I add something to that? The enforcement, I think there's another important cultural aspect of this, which is that I think the more people recognize that covering your face is actually something you're doing for those around you, there should be a social pressure that is exerted there that it's recognized as a matter of community responsibility and welfare. And it's a matter of, it's rude, in fact, not to be doing that for those around you. And if you are certainly someone who's more vulnerable, that's certainly someone to avoid. If you're out in public and you see someone who's not covering their face, making sure you're offering a wide berth. But it reminds me of, when smoking cessation, when people, secondhand smoke became more obviously at risk, and people would ask one another, please don't smoke around me, or peer-to-peer enforcement is an important aspect of this as well. So gentle reminders, I think, between those of us in this community, I think will go a long way for enforcement also.
It's a really great reminder, Well, I want to shift gears now. Earlier in Dr. Willis's presentation, he mentioned some of the activity that's taking place in our senior living facilities, our long-term care facilities. And frankly, the number of COVID positive patients among residents and staff at our nursing homes is alarming, especially after so many weeks of low prevalence. Can you address why the number of cases has risen so dramatically, especially given that patients are not receiving visitors at this time? They're really only in contact, the only contact these patients are having are with the healthcare workers. And in that same vein, can you tell us if the facilities themselves are required to do any amount of screening of workers or anything before they report to work?
I think as I said, the staff members, the dynamic is that staff are infected in the community and bring it into that setting, which is another reason why we just all need to be on our A game, that to not transmit it in our everyday lives. The one way to obviously in any business setting, and especially important in those residential care facilities, is to screen staff for symptoms before they come in, and that's happening across the board. at these facilities. There are limitations to that. Many people do not have symptoms who may be infectious to others, which is why we're recommending and have issued a health officer order that requires every one of those facilities to test all of their staff monthly in blocks of weeks. So a quarter on week 1, a quarter week 2, quarter week 3, and then 4, just continuously cycling through serial testing of their staff to catch those who may not have symptoms but may be infectious. And that's the strategy. And then obviously within the facility, making sure that they're using the proper PPE and physical distancing. And it's that combination of strategies, I think, that is most protective to those residents.
Okay. Well, staying on the theme of some of our more vulnerable residents here in Marin County, if you look at the data, you'll see that there's a high incidence of COVID-19 among our Latinx population here in Marin. And while they actually only represent 16% of our total population, I think the incidence rate was about 70%. Dr. Willis, I know you shared that many individuals in the Latinx population are our frontline workers. Thank you for acknowledging that. And we know that some may live in multi-generational households and others may only be monolingual Spanish speakers. So given this situation, and Angela, this may be a question you want to address coming from the EOC standpoint, can you elaborate on the strategy that Dr. Willis mentioned, and also explain what the county and maybe what the city of San Rafael has been doing to communicate not only the seriousness and the details of the pandemic with the Latinx community, especially in the Canal community, but what supports might be available for those that test positive for the virus?
Sure, thanks for that question. Like you said, 78% of the positives in Marin County have happened in our Latinx community. And so we are focused on how we provide services to that community. I think a big piece of our work is really partnership with our local nonprofits. So we've got partnerships in the Canal District, also partnerships in Novato, working on making sure that we have bicultural and bilingual support in that community. We are also providing food and doubling down on testing. We've got testing almost every day of the week in the community. And this morning I heard that we had the full allocation of tests. People were lined up by 9 o'clock and testing doesn't start until 1. So we've done an extraordinary job getting out information that testing is really important. And now we're trying to really work with people to make sure that we get resources to people so that they can isolate. I think one thing that you mentioned, Lainey, about living in multi-generational housing or also living in extremely dense housing is that people are having a hard time isolating and quarantining. So we have a disaster services fund where we're providing resources to families so that they can isolate and stay out of the workforce for 14 days. We have hotels available in the event that there isn't the possibility of isolation. We're delivering food into homes. I think also through the partnership with San Rafael, we've got hand washing stations and disinfectant stations, and really making sure that we're getting out in many different languages, question and answer sessions and information about testing so that people have the information that they need so that they can make decisions about how to keep themselves and their families safe. And I do want to double down on that. These are our service providers. These are people that are every day providing services in Marin. And it's our responsibility to make sure that we continue to really dig deep and provide better service in that community.
Can I just highlight another partner in that, which is our Marin Community Clinics and some of our federally qualified health centers. That's where I got my start here in Marin, was as a physician at MCC. And they have 40,000 patients in their network of clinics across Novato, mainly San Rafael. And it really aligns well with this community that's most vulnerable. And they've stepped up to really, they are more than just a clinic. They're a hub for health and well-being for those communities. And we're partnering with them, and it's a real asset to have that in our community.
That's great to hear. Since Angela mentioned testing, I'm going to use that as a launch point to bring up a couple of testing questions, since we received quite a few of those. And we've heard everything from, dissatisfaction that we don't have more test sites, or that, much like the example that Angela provided, the test slots seem to fill up well in advance. So what efforts are being made to increase our testing here in Marin, or what is Marin doing actively to try to meet that increased demand that we're seeing as of late?
Yeah, I mean, our testing rates per capita are among the highest in the state, and still we want more testing, and it's because we recognize again the value of testing for really understanding the dynamic and intervening as early as possible in the cases where we're seeing them. One of the realities is that there's been just a national constraint on testing, just as part of the story of this pandemic in the United States has been one of scarcity in terms of testing resources, and we've been fighting that battle all the way along, and extracting testing opportunities and resources from a variety of different supports, academic supports. UCSF does some of our testing, the state lab does some of our testing, the regional lab does some, the private labs, really trying to optimize that whole network. We're now, I think the next stage of testing is really for healthcare providers. As we emerge into the next stage of COVID-19 and seeing more cases, this is a matter of standard of care for healthcare. Early in this pandemic, testing was viewed as a public health function. But now that we're doing, our demand is going to need to be about 800 to 1,000 tests a day potentially across the county, diversified, and everyone should be really looking to their healthcare provider first as the source for a test that may diagnose an illness where they might need treatment. It is a matter of healthcare responsibility, and so that's a shift that's happening in more and more of our healthcare providers. Kaiser, Marin Health, One Medical, our federally qualified health centers are offering testing for their patients. And so it's going to be, I think, a complementary relationship between healthcare and public health that will address this testing scarcity moving forward.
I think, Lainey, I want to add one more thing, which is our mobile testing unit. We do have a mobile testing collaboration between the county and Kaiser and Marin Health. And if there are cases where there is an outbreak, we are able to get out onto site to test people really quickly. So I think that's been our agility in that testing has been really, really useful during this pandemic.
Great, thank you for adding that on. So with testing comes contact tracing, and we know that in that toolbox of stopping the spread, that those two go hand in hand. Dr. Willis, and I'll just read the question as it came into us. Do you believe that contact tracing is being done effectively here in Marin County?
Yes. Yes. I mean, it's a challenge like everything else. As more cases come in, fortunately, we have a team of now almost 60 contact tracers who are spending, their time on telephones, reaching out to cases. Now we're seeing 50 to 60 cases, new cases per day, and we need that resource of that workforce to keep up with that demand. And we're hiring more. We just got 15 more on staff who have that bilingual, bicultural capacity that's so important. And the process is really to just reach out to every single case and perform an interview to determine what their contacts might be, what their work environment might have been, whether or not they need to be offered housing if they're in a housing situation where they can't isolate from others. And that is a key arm of our response. The main challenge right now, one of the main challenges relates to testing, which is because of the statewide demand for testing has increased, the laboratories are moving more slowly, and the private laboratories and others, and it's a delay statewide in getting results back. And it's always painful when we get a result that was from a test that was obtained a week earlier, because if it's positive, there's missed opportunities there to have prevented transmission. And so that's something that's been really clear to the state, that we need to do everything we can to reduce the time of our processing of the lab samples, but we're keeping up with the contact tracing.
Great, that's good to hear. So let's shift more to our our younger residents, our children, on our families. And we've had quite a few questions that were submitted as it related to anticipation of what may be coming in the fall for the return of schools. And really, we've heard from parents and educators alike that more information and planning is needed around the upcoming school year. So can you elaborate a little bit on what Marin Public Health is doing to plan and prepare, and who might be involved in that process?
Yeah, I mean, we've had a strong historical relationship with the Marin County Office of Education. I think there's just been a shared understanding that what happens in schools is core to community health, and we've approached this pandemic in that way. Mary Jane Burke and the Office of Education and we share a vision that the best place for kids is in school, and we're orienting our strategies to try and ensure that happens as safely as it can. The distance learning experience, I think, taught us a lot about the limitations of the assumption that that children can have, that all children can have a meaningful learning experience distanced, and that is actually inequitably distributed, and some households simply aren't able to manage keeping up with their education in that structure. Furthermore, when schools are closed, there's new evidence that in some communities, actually disease transmission increased. And that's because if that one child can't stay home with that one parent, you have other networks where children are gathering in other ways, where there may be even more mixing outside of the school setting. And so the assumption that a school closure will limit mixing of children is not a safe assumption and might actually amplify spread. So I think there's a lot of important considerations here. And we know how to do this. There are ways to organize the school day, to organize the classroom setting, to ensure that there's the proper screenings, that children are cohorted. And we've developed a set of 30 specific recommendations for safe reopening of schools in concert with Marin County Office of Education. And we are doing weekly conversations with the education community to march through those different recommendations, to answer questions, to ensure that everyone's prepared. Ultimately, it's up to the schools and the school districts, and we're offering public health recommendations. But our sincere hope is that we're doing everything we can to get kids back to the classrooms.
Great. Thank you for that update. And those that are interested can go to Marin County Office of Education's website, looking for the Rethinking Schools page. And there you'll see a number of resources from recent conversations with Dr. Willis, as well as other experts as it relates to the guidelines that have been issued for reopening. So that's another resource for all of our viewers. Well, I think we have one more question, or time for one more question, that is. And we didn't give an official count, but if we were to estimate, by and large, the most popular topic of question that came in had to do around the outbreak at San Quentin. And Dr. Willis, I believe you covered, you answered a lot of our questions in your presentation, so thank you for that. But one question that came up quite a bit that wasn't addressed was, why did Marin Public Health decide to divide the data that we put on our website? So we have cases that are confirmed among Marin residents, and then we have cases of people who are incarcerated at San Quentin. The state has developed a dashboard where all the data is combined. So can you speak a bit more about why that decision was made, and provide some clarity? I know you've already provided clarity on the number of hospitalizations, so thank you for that. But just some background information on why that decision was made.
Well, they're both important. What's happening at San Quentin is important, and the lives of those men are important, and they deserve the highest available standard of care. That's not a question. The reason that we look at them together and separately is that, as I hope I illustrated earlier, we use data to be as precise as we can in terms of understanding the dynamics of transmission within our community. Because it's like a physician who's doing diagnostic tests for a patient. You need to know whether this is a kidney problem or a liver problem, or what, and that's how I think about the way we use data for the community. Is this happening in San Rafael? Is it happening in essential workers? Is it a different dynamic? Is it farm workers in West Marin? We need that specificity, descriptive power. And when there's a giant influx of numbers and cases that is epidemiologically distinct from a sequestered population, it can obscure that signal that we see from within our own community, from within our own cities and towns. And so I need to be able to discern with more specificity what's happening in the non-San Quentin environment, as well as within the San Quentin environment. And the only way to do that is to in some ways separate them for some of the analyses, and then combine them also to have a better sense of the totality of our experience in the county.
Great. Well, thank you for that. And with that, I do want to remind everyone that our data is available to the public, not only the great graphs that Dr. Willis shared during his portion of the presentation, but downloadable data on a daily basis is available at our coronavirus.marinhhs.org/surveillance. Well, I want to thank everyone who tuned in, whether it be through Zoom or through Facebook, to watch our community conversation this evening. And this video was recorded, so if you'd like to be able to go back and share it, and you're not a Facebook user, but you're joining us on Zoom, it will be published onto our YouTube page by tomorrow morning, and we will be sure to share that out. Again, our central resource for all updates and information as it relates to COVID-19 is available on our website, which is coronavirus.marinhhs.org. And if you have any other unanswered questions, you're welcome to call our call center, which is available Monday through Friday. And you can reach the call center by calling 415-473-7191. With that, I want to say a big thank you to our three panelists. And again, thank you to all of you for watching. Stay safe, Marin. Continue to wash those hands, stay 6 feet apart, and cover your face. And we look forward to talking again with you soon. Thank you.
Thank you.